Today, we're going to talk about the 3 secrets to fill your appointment book with ease, increase your income while reducing your effort, and have happy, satisfied clients coming back for more. So, first of all, let's take a look or think about or visit why we all became massage therapists. These are some of my reasons, and they might ring true for you. So, why did you become a massage therapist? Because you are a natural caregiver and you love helping people. Possibly you're fascinated with learning about the human body. Maybe you love the art and intuitive nature of massage. Or being a massage therapist probably taps into your natural talents and abilities. And if you're like me, you're probably self-driven and you want to earn an income doing something that you're passionate about. So massage therapy is estimated to be a $16 billion per year industry in the US, and I'm sure it's very close to that in Canada as well. The US stats say that almost 60 million Americans got at least one massage last year, and that's about 24% of the population. So that's a lot of people who are out there and need our help. So, where are all the clients? How many of you thought that once you completed your basic training, that clients would just flow to you with ease and so would the money? That is possible, and that's exactly what this webinar today is all about. So I hope you stay tuned and stay right to the end. But how many of you feel like you're struggling looking for clients all the time? You don't have a steady stream of satisfied, happy clients that you thought you would. This is a beautiful waiting room, but we don't want our waiting rooms to look empty. Or how many of you are possibly worried about hurting yourself and not lasting long in this industry? Massage therapy is a very physically demanding job or career, so we have to make sure that we take care of ourselves first. Or perhaps you don't feel confident in your ability to treat all the different problems that show up on your treatment table. And you feel like you need help, but you're not even sure where to go to get that help. Some of you also might be frustrated that you spent tons of money on your basic training and now you're afraid of becoming a statistic and not lasting long in this industry. Well, when I started out, I was right there too, and I, of course, had many of those same fears. But today, I really want to speak to you about how I can help you stand out from the crowd and be the therapist that clients are lining up to see. We don't want to have any of these struggles or frustrations that I just talked about. One thing I know for sure is you cannot become who you want to be by remaining who you are. I love this quote. And first of all, I want to thank you for being here today and being the kind of person that takes action and shows up for these types of online trainings. A lot of people register, sign up for the training, and then don't show up. So first of all, give yourself a pat on the back for showing up for yourself this morning. And I want to thank you so much for being here. I feel truly blessed to be able to be here with you today, especially people from all over the world, and be here to serve and support you. So thank you very much for being here. Before we get started into the meat and potatoes, the content of the webinar, I just probably should introduce myself to you. Some of you know me, but many of you don't, and give you a little bit of context around why you should even be here listening to me today. So my name is Cheryl Stevenson, and I've been practicing and teaching therapeutic massage for 25 plus years now. I'm not going to tell you how old I am, but I'm mature, let's put it that way. I've really seen firsthand how therapeutic massage can have such a profound impact on people's health and well-being. And my titles include a teacher, a registered massage therapist, a business owner, the Tissue Talk mentor, and a mindset coach. So brief history of Cheryl is I didn't start out as a massage therapist, but I've always really been fascinated with how the human body and how it works. And as a little gal, I was quite the athlete. So of course I ended up going to university and getting a Bachelor of Phys Ed degree and became a high school phys ed teacher. And I actually taught high school phys ed and health for just over 10 years. And then I decided to go back and get a master's degree in kinesiology. And for a while, I wasn't really quite sure what I wanted to do, but I ended up leaving my teaching position to teach in a private massage therapy school in Red Deer, Alberta, where I live. And I was teaching the anatomy and physiology. It wasn't long after starting to teach there that the experienced school owner kind of decided to take me under his wing. And I became really immersed into learning everything I could about massage therapy. And it was then that I began to realize that everything that I had done to this point in my life, all of my education and training in physical education and all the anatomy and physiology, had led me into the massage therapy industry. So, long story short, I passed my provincial board exams and my new career as a registered massage therapist was born. So, I ended up working at this school clinic for about a year. And then I decided to open my own clinic specializing in therapeutic massage, and rehab exercise programs. So, it wasn't long before my list of clients really began to grow. And I started to realize that I was doing something than most different than most massage therapists. I seemed to be giving them better results and better results than they'd ever had anywhere else before. So it was then I decided, okay, I better start hiring some other therapists to work with me. And to be honest, it was a real struggle to find therapists that were providing the same kind of treatment that I was. So, being the teacher that I was, I decided to find like minded people who were really interested in learning what I had to teach them. And I started training and mentoring my staff. Long story short, I had a very successful practice for over 16 years and employed many highly skilled therapists. But then I began to realize that I could really impact so many more lives by teaching rather than doing. And I also remembered that teaching really is my superpower. So I decided to close my practice after 16 years and started my training company called Perfect Balance. And Perfect Balance really became a perfect marriage between my education and experience as a teacher and my passion and expertise as a massage therapist. So I'll be sharing a little bit more about my company Perfect Balance with you at the end of the masterclass. So make sure that you stay tuned. Okay, so enough about me. That's a little bit of my background. Let's get into the meat and potatoes of today's presentation. And the goal of this masterclass is to help you dramatically increase your income efficiency and effectiveness as a massage therapist while reducing your effort. So my mission really is to empower therapists just like you to unlock your true potential and create more impact and more income than you ever thought possible. I often work with registered and licensed massage therapists who are struggling to build a steady stream of satisfied clients, and they're not making the income that they thought they would. But I really know from my clinical experience and my education and training what works and what doesn't work, and I'm passionate about sharing that all with you. I'd love to help you become the go-to expert and fill your appointment book with ease. And if you already are that go-to expert, I hope to inspire you and open up some different and new ways of doing things that might even propel you forward even a little bit more. I'd like to introduce you to one of my successful Tissue Talk graduates, Mandy Schuler. And she says, I feel truly blessed to have found you and your advanced training programs. I feel like I'm looking through new eyes and I'm so much more confident in my profession. Your techniques have absolutely given me the skills I need to truly assist my clients. And for that, I am forever grateful. So this masterclass is designed to reveal the 3 secrets to you to elevate your expertise as a healthcare professional, build a sustainable business with a consistent income, and develop intelligent and intuitive skills to talk to the tissues. And I'm going to tell you lots more about that as we go along. Okay, who's ready to get into secret number one? Maybe put in the chat box, yay, I'm ready to get into secret number one. Yay, yay, yay. And if you have a question, you can just type it in the chat box there, and Cindy will do her best to answer you. Secret number one is the one thing that causes many massage therapists to fail and never achieve their full potential, even when they've graduated from a reputable massage therapy school. So why is it that some massage therapists have thriving practices, whereas others continue to struggle? And what will set you apart from the rest? Well, let's just take a look at stats for a sec. The sad reality is that many therapists drop out of our profession in the first 5 years, and that's a very sad reality. And 50% of those dropouts are often due to physical injury related to performing treatment. The high dropout rate is also because of mental and emotional burnout, unrealistic expectations, lack of confidence is a big one, and lack of business experience is a big one. So stats show that 50% of therapists earn less than $30,000 a year. What saddens me about our industry is that the number of therapists who have to, who just aren't making enough money, and they have to get a second or third job in order to sustain their income. And what's even sadder is how many massage therapists actually drop out of our profession way too soon after spending so much money on their basic training. But there is lots of good news as well. Being a massage therapist is very fulfilling and can be very financially rewarding. Indeed.ca states that job prospects for therapists is very good, and that more Canadians are seeking massage therapy treatment to help improve and maintain their health. They also rely on massage therapy to treat sports injuries. So the top 10% working in the massage therapy profession earn more than $75,000 a year. And that sounds a lot better, doesn't it? You too can have a thriving massage therapy business. And I really want to help you reach your true potential. And if you're not there already, be one of those successful therapists that are earning closer to $75,000 a year. So how do we do this? Well, part of it is becoming a pain relief superhero that's not settling for average. It's boosting your earning potential so that you can be one of the top 10% of therapists earning that over $75,000 a year income. So don't settle for average. Become a pain relief superhero. If you want to stand out from the crowd, I believe that the biggest problem in our industry, and the reason why so many therapists struggle, is that they've been trained to perform a massage routine instead of a massage therapeutic treatment. So secret number one is really all about helping you stand out from the crowd. And what helps you stand out from the crowd is differentiating yourself from everybody else. And it's choosing not to be that cookie cutter therapist, but choosing to be the expert. So secret number one is really all about your mindset and you choosing to be that exception. So there really is a big difference between relaxation massage and therapeutic treatment. Now, don't get me wrong, if your practice is mostly relaxation massage, that's awesome. And there's tons of people who need relaxation therapy, and that's exactly what they want. But there's also tons of people that really come to us because they want relief from their pain. And I really feel that there really needs to be a distinction between somebody who's doing relaxation massage and therapeutic massage, especially right now when our associations, a lot of them are looking at cutting massage therapy out of, our associations are trying to help us get governed under the Healthcare Professionals Act so that we're looked at as Healthcare Professionals Act, as healthcare professionals. And a lot of the insurance companies are slashing expenditures for massage therapy because we haven't done that yet. So if you work in a province or a state where you're governed under the Healthcare Professionals Act, that's probably really helping you take your career to the next level. So we know there's a difference between relaxation, massage, and therapeutic treatment, and we need the government to understand that we are healthcare professionals. And really, we need to embrace the fact that everybody is unique. Every body and every condition is different. So it's really our jobs as therapists to approach each person and each session in a unique way. So if you become a pain relief expert, you can treat all these different problems that show up on your treatment table. I want you to take a second right now and just think in your mind or jot down, if you've got a piece of paper, how many different types of pain did you treat in the last week or in the last month? Think of all the different problems that showed up on your treatment table and all the different kind of pain patterns that we need to be able to deal with. If we're doing a recipe kind of a massage and being that cookie cutter therapist, it's often hard to give people successful outcomes if we're not providing that therapeutic treatment. So I want to kind of bring a paradigm shift to you today. And to do that, take a look at doctors and how people look at doctors. So a GP, or a general practitioner doctor, sees everyone for general conditions and they get paid accordingly. Although they still get paid better than us massage therapists, but GPs are a general practitioner. They know a little about a lot of things. And then there's specialists like cardiologists and dermatologists, anesthesiologists. They know a lot about some specific things and can solve specific problems. And they earn double, if not triple, of what a GP earns. And they do have a list of clients or patients waiting to get in to see them. They're being sought out all the time because they're specialists. So that's the kind of thing that I want you to think about as a massage therapist. And it's really what secret number 1 is all about. It's the 6 inches between your ears. It's deciding not to be average, deciding to be the exception, and you will create the business and the life that you want. And bottom line, if you're not currently achieving the results that you want, the first step in creating more success is to shift that mindset and decide to do whatever it takes to be who you want to be, to have what you want to have. So bottom line with the first secret, it's all about your mindset, and being the exception, not being the average, is going to elevate your confidence. Instead of looking at yourself as that little kitten, you're going to see yourself as that big lion, okay? And your confidence is developed, your confidence is grown, your confidence is earned. And when you feel more confident, it shifts how you see yourself, and that's really what can transform your practice or anything in your life. So being the exception elevates your confidence. Being the exception also elevates your competence. When you expand your massage therapy toolbox, your ability to provide more effective treatment also expands. You take your natural talents and you develop your skills to be the best therapist that you can be. And it's really a revolving wheel. The more confidence you have, the more competence you have, the more confidence, the more you feel confident in what you're doing. It all really creates this beautiful wheel that creates more and more for yourself. And being the exception will also help to multiply your magnetism, You will automatically attract new clients. Repeat clients will start referring their family and friends, and it'll feel like the clients are flowing to you with ease, and so will the money. So what I encourage you today, before we move into secret number 2 and number 3, is make the decision to rise above the rest and do whatever it takes to become a therapeutic massage specialist. Don't settle for being average. Don't settle for being the same as everybody else. but become a specialist and become elite. And really, everything starts by making that decision, and it's in the mindset that will shift your success in your practice and in your life. So that's your pep talk. Before we get into secret number 2 and 3, it's shift that perspective if you need to in your mind and decide to be the best. Decide to reach your true potential. Shauna is one of my students who is an absolute perfect example of what can happen in your career when you decide to do whatever it takes to achieve what you want. Shauna's taken probably every training that I've offered over the last several years, and she's a Tissue Talk Academy graduate. And she states that every client that I have had this week is amazed on how good they feel, and I'm extremely excited about what I have been feeling. You have opened my eyes so wide to a different way of approaching my treatments. Your advanced training programs have made a huge impact on my skills and what I can now offer my clients. So are you guys with me? Are you getting this? I want this to be you. I want you to feel like Shauna just stated right now. Okay, so that's your mindset pep talk for today. Take a deep breath and just take that all in. And put in the chat box, yeah, I want to be elite. I want to be the pain relief superhero and be the therapist that clients are lining up to see. Okay, who is ready for secret number 2? Secret number 2 is all about the one fundamental change that you can make to have an abundance of happy, satisfied clients and make more money. What can you focus on that is going to change your results? I really believe it's all about working smarter, not harder. And a precise and targeted skill set will decrease the strain on your body and increase the effectiveness that you have as a therapist. And also remember that you are your business. You are your most precious asset. So you really need to take care of yourself first. You need to understand how to work smarter, not harder, not only to be more effective for your clients, but to make sure that you last longer in this very physically demanding career. So secret number 2 is all about what I call intelligent treatment. Intelligent treatment utilizes your knowledge and understanding of anatomy and physiology and pathology. It requires a much more precise and targeted treatment approach, not a recipe massage. It will yield a lot more complete and longer lasting results for your clients. Now, during this masterclass today, I want to give you an example of intelligent treatment by taking you on a tour of the neck. I want to teach you about a very challenging muscle group that requires very precise and intricate treatment. And this is a taste of what you will learn if you choose to enroll in the Tissue Talk Academy. And I'll give you tons more details about the Tissue Talk Academy as we go through this webinar. So I hope you stay around to the end. And I also have a little gift for you at the end as well. So let's dive in to the neck. Okay, tour of the neck. Neck pain and stiffness is one of the most common problems driving people into our practice. When you think about it, I bet you almost everybody that comes into your practice is complaining of neck pain or stiffness or headaches or something to do with neck pain. The neck is often referred to as the master volume switch because it affects pain patterns everywhere else in the body. And research shows that if you deactivate problems in the cervical region, everything else will respond positively. Other things about the neck, really small positive changes in the neck can make massive differences in the rest of the body. If you have a neck issue, it will increase your likelihood of having a lower back issue by 3 times. Lower body and pelvic imbalances cause the neck imbalances to worsen because the neck, being a lot smaller vertebrae, is the most movable joint. Other interesting things about the neck. We all know about forward head posture, and just as I'm looking at this picture, I'm sitting up a little straighter myself. A normal head weighs about 12 pounds, and the brain perceives the head as weighing double for every inch it migrates forward. So if you have your head jutting forward 2 inches, now your 12-pound head feels like 42 pounds. And then you also end up with kyphosis and all the problems that go along with that as well. So one of our jobs as therapists is to really help people with their posture and realize when they have something like forward head posture and how negatively it's going to affect their head. Okay, so now what I'd like to do is take you on a bit of a journey through the anatomical Bermuda Triangle. And of course, that is the scalenes. And a ton of crazy things can happen in the scalenes. And it's my opinion that the scalenes are probably one of the most overlooked and undertreated muscle groups in the body. So let's take a quick look at the anatomy of the scalenes. The scalenes are between the SCM and the upper trapezius and levator. So if you can see my arrow on this illustration here, this is the SCM. Here is your levator and traps. Your levator's right here, and this is your upper traps. And then these three little muscles right here, the posterior, the middle, and the anterior scalenes. So they're really trapped in between the other tissues in a very small area. They originate on the upper cervical vertebrae, the transverse processes, and they come down and insert on the first and second rib, okay, which is really important to know when it comes to thoracic outlet symptoms. And then you can also see how the C5 to T1 nerve roots pass through the scalenes before joining into the brachial plexus. Let me just take you back there again. Okay, the nerve roots and also the arterial and venous blood flow pass right through the, specifically the anterior and middle scalenes. The other really interesting and wild thing about the scalenes are their wild referral pattern. If you have trigger points, adhesions in your scalenes, you can get all of this different pain down the front and back of your arm. It kind of skips the elbow, but it can go down the front and the back. It extends all the way down to the radial side of your forearm and into your thumb and index finger. And it can also give you this real kind of persistent ache in your pectoral region, and also give you a referred pain pattern along the vertebral border of the scapula. So the referral pattern for the scalenes is crazy. And when you're treating the scalenes, it can often feel like the patient's arm wants to implode from the inside out. And it can be a very intense and kind of a scary feeling. And you need to understand what the scalene referral pattern is so that you can explain this to your patient and show them how you can help them get rid of this referral pattern. And then, as I said, the scalenes are very much involved in neurovascular entrapment because they can entrap this brachial plexus and the subclavian artery and vein. And specifically, they come right through the anterior scalene here and the posterior scalene. And also the posterior scalene can also become very adhered to the levator that is behind the scalene. And together they pull up on the brachial plexus and cause thoracic outlet symptoms as well. So the scalene muscles, if they're tight, they're going to pull upwards on the clavicular area, and then they come down and attach on the rib, and the levator and the pec minor can pull down on this clavicular area, and it can be just a real tug of war back and forth, causing more and more nerve entrapment symptoms. And that's what I've got on this point. To shorten scalene and levator tissue pull up through the clavicular area, and the pec minor pulls down, causing increased nerve entrapment issues. So the scalenes are a really good example of a muscle tissue or muscle complex that needs to be treated with very intelligent treatment. So the one fundamental change that you can make to have an abundance of happy, satisfied clients, get more referrals, and make more money is to up-level that scientific approach and use your intelligent treatment to work smarter, not harder. I'm gonna tell you a lot more about how you can develop that intelligent treatment as I go through this webinar and tell you a little bit more about the Tissue Talk Academy. So please make sure that you stay tuned. Summary of all the different things that you have to be thinking about when you're doing intelligent treatment. It really utilizes the knowledge that you have of your muscle origins, insertions, and actions to determine the best treatment approach. Its intelligent treatment is mastering how to isolate each muscle group and individual muscle fibers. And the example of the Bermuda Triangle of the scalenes shows you how important that is. It's also understanding how an agonist versus the antagonist, and also how each action has synergist and stabilizing muscles, and they all work together. And we need to know which muscles work together with others so that we know what other tissues that we should be treating. For instance, in this example, was we talked about the scalenes pulling up on the clavicular area, and the pec minor would be an antagonistic muscle pulling down. So we need to know if we need to treat the scalene tissues because they're tight, causing nerve entrapment. We're also going to need to treat the antagonist, which is pec minor, and a few other things. So it's really understanding how those muscle groups work together. Intelligent treatment is also understanding the pain referral patterns. And again, I gave you a really good example of that with the scalenes. Also understanding things like fascial connections and how they affect our movement and our function. And knowing how to assess, do an assessment of function and a movement of a joint. And all the nerve innervations and all the different things that we learn from a scientific point of view. So it's the science of massage, what we know. Janine is a really good example of a person that is understanding how to use intelligent treatment and using sideline treatment for the neck, which I'll talk to you more about in a minute here too. And Janine states that my clients are getting great results. I feel so inspired and excited to use these techniques. When I put a client in side lying position, it is so much easier for me, and they feel the difference too. One client said to me, in 20 years of getting massage, I have never been put on my side before. She is now a repeat client, and she's feeling so much better. Thank you for your wonderful teaching skills. And so Janine was able to really perform intelligent treatment on the neck for her client by utilizing side-lying treatment, which is really effective when it comes to neck treatment. Again, more about that in a second. That secret number one was all about deciding not to be average, but to become the exception. Secret number two was all about up-leveling your scientific approach to massage. Secret number three, who's ready for secret number three? Drum roll, put in the chat box. I'm ready for secret number three. Is all about the intuitive part of massage therapy, or the art of being a massage therapist. And what I would like to show you today are the 7 keys to developing intuitive touch. 7 keys to tapping into your artist within as a massage therapist. So the art of massage therapy taps in or awakens that massage therapy artist within. And it's really this intuitiveness that is vital to becoming an elite therapist. You have to have both the intelligent treatment and the intuitive touch to really become a good, effective therapeutic massage provider. And one of my favorite quotes is from the late, great Ida Rolf. And she states that it's not how deep you go, but how you go deep. Let me say that one more time. It's not how deep you go, but it's how you go deep. So tissue talk, the reason I came up with the idea of tissue talk is because I see being an effective therapeutic massage therapist and having that intelligent and intuitive touch is being able to talk to the tissues with your hands. So talking to the tissues with responsive, sensitive hands, and you're going to feel your way into the tissues. Then the other side of it is listening intuitively to what the tissues are telling you. You need to train your receptors in your hands, in your elbows, whatever it is that you are using to pick up the information that the tissues are sending you. But you also need to respond effectively and efficiently by applying what you know, which is the science, and what you feel, which is the art. So that's why I refer to this as talking to the tissues. So now let's get into the 7 keys of intuitive touch. So the first key of being an intuitive therapist is to invite your way in. Your hands or whatever your palpating tool is, even if it's your elbows, should ask for permission to go in, not force your way in. You need to listen for that tissue response, and you need to try to sense what the body needs and wants. So the first key to being intuitive is inviting your way in, not forcing your way in. Key number 2 is to be very precise with your pressure. This image is one of the scalenes like we've been talking about today. And you can see how there's 3 bellies to the scalenes, the anterior, middle, and posterior scalene. And you have to know exactly where these originate and where they insert and what actions they do in order to treat them properly. So I really like to think about sliding through the fibers to investigating them, doing your detective work, and then sinking into the adhesions as you come along them. You need to ensure that you are palpating your target tissue before you start to sink deeper. So again, if you're working on the scalenes, you have to make sure that you're in the scalenes before you start to sink deeper into an adhesion that might be located in those scalenes. You need to think about that the deeper you go, the more intuitive your touch needs to be. And only go deep when you get there. You don't want to be deep along the whole muscle belly if you don't need to be. You just need to go deep into the area where the tissues are adhered. So key number 2 is being very precise and targeted with your pressure. Key number 3 is really focusing your awareness on what it is that you're feeling. Focus your awareness on what you feel. You want to feel for the tissue barrier and focus on meeting the tissues and waiting for a response. So by tissue barrier, I mean, do you feel it like it's fibrotic or adhered tissue? And then waiting for the response. Do you feel the tissue texture is changing as you palpate that tissue? Can you feel a melting or a softening of the adhered tissues? So you really have to be focused in on what it is that you are feeling. Key number 4 is be present with your client and intentional with your touch. So you not only have to focus in on what you're feeling, but you have to be present with what's going on with your body on the table, your client. Remember, it's their treatment, not yours. And you need to stay dialed in with how your client is responding to your touch. Okay, how are they responding to your touch? Can you feel pain in their tissues? Now, of course, you can't feel their pain, but as an experienced intuitive therapist, you can, quote, feel pain. You can tell when the palpation is painful for your client, and you have to stay dialed in with that so you're working within their comfort zone. You need to listen to the tissues and respond to what you are feeling. And you can't do that if you're not focused on your treatment intention. So yes, you can visit with your clients and you can do all that, but you have to be able to do that and also really stay dialed in to how your client on the table is responding. Remember, it's not a recipe treatment. It's a specific treatment for that specific person on that specific day. Okay, another one that's an obvious one, but a lot of us forget anyway, is work with the breath and at your client's pace. You only want to increase your treatment depth as your client allows you to, and you can work with the breath, and as they exhale, you can go deeper into the tissues. Key number 6 is remember it takes time for the body to change. You need to work together with your client to achieve the desired results. And to do this, you also need to educate your client about how they can take an active role in the process to get more complete and longer lasting results. And part of this is developing a treatment plan and making sure that you communicate that to your client and that both of you are on the same page and realize that it's going to take time to make some changes. And here's some of the things that you can do in order to make those changes last longer for you and be better for you. So remember, it takes time for the body to change. And then the last key, maybe my favorite, is make friends with the tissues, not enemies. Okay, remember that this is their treatment, it's not yours. You want to work within your client's comfort level and only increase your treatment depth as their body accommodates to the pressure. Okay, your receptors, your hands are picking up on the information that the tissues are telling you. And it's a win-win relationship, not divide and conquer. You're not there to show them how strong you are. You're there to help their tissues respond in the best way to what you are doing to give them more complete and longer lasting results. So work within your client's comfort level and increase as their body allows you to do that. So those are the 7 keys to being an intuitive therapist. So when you put this all together, I designed this as what I call the Tissue Talk formula, and I hope that this really resonates with you. The Tissue Talk formula is all about taking that intelligent treatment together with your intuitive touch, and that's really what allows you to have magic hands. And all of us in the biz know what people, when clients come and say, you've got magic hands, that makes us feel amazing. So it's really all about that intelligent treatment plus the intuitive touch that allows you to have those magic hands. And of course, that's what you want to have. So I hope this is making sense to you guys. And it's really my mission to empower therapists just like you to unlock your true potential and create more impact and more income than you ever thought possible. And I'd really love to help you stand out from the crowd and become the elite therapist that clients are lining up to see. Let me ask you a quick question. So we've been going for like almost an hour now, I guess it is. And I really hope that you're getting tons of value from the masterclass today. And would it would it be okay with you if I show you a little bit about my Tissue Talk Academy online program that I have for you? The Tissue Talk Academy is really an amalgamation of everything that I've learned over my last 25 years of practicing and teaching massage. And it incorporates all the skills and the strategies that helped me to stand out from the crowd. And it's really a complete library of online training right at your fingertips. And you can even take the materials and review them right before treating a client and help you to devise a treatment plan right before that client comes into your treatment room. So I think now is a really great time for you to expand your massage therapy toolbox and take your treatments to the next level. I really believe that you can really have a huge impact on the well-being of our clients and create an amazing income as a therapeutic massage provider. And that's what I'm here to help you with. So When you harness the power of the Tissue Talk formula, you're going to get time-tested, effective therapeutic techniques that will help you become an elite therapist. It's going to really improve your skills and your confidence so you can create greater client satisfaction, greater retention, and get a lot more referrals. And as a Tissue Talk expert, you will feel like an expert and your clients will treat you one. So you can stop spending your time and money looking for clients. You're going to have that lineup of clients waiting to get in to see you. You can stop working so hard. You'll understand how to work smarter and not harder. You can stop working with conditions and clients that you don't really enjoy. You don't have to be working with every client or every condition if you don't enjoy those. When you become a Tissue Talk expert, you'll be able to pick and choose a little bit. You can probably even raise your prices. Not probably, but you can raise your prices and make more money doing less treatments. You will stand out from the crowd because you provide treatment unlike any of your competitors. You will have a waiting list of happy, satisfied clients. And you will attract more of your ideal clients because you give them solutions to their problems. Here's another testimonial from one of my Tissue Talk graduates, and Robin says, using the techniques from Tissue Talk, which I affectionately call the Cheryl technique, my clients have shown great improvement, and we are thrilled. Your intuitive teaching style makes feeling the tissues easy to understand. My clients can't stop raving about the new techniques that I'm using and the results that they are getting, and I am getting tons of new referrals. So can you imagine what it would feel like if you have your clients saying these same things? I see a couple of hell yeahs in the chat box. Put hell yeah in the chat box for me. So the Tissue Talk Academy isn't something that I just came up with like everybody else is these days with COVID and creating online products. This is something that I've been developing for over 10 years, and there's currently over 60 modules available in the Tissue Talk Academy, and presently over 100 successful Tissue Talk Academy graduates. Unlike other products, the Tissue Talk is kind of like Netflix for the massage therapist. It's a one-stop library of techniques that you can view on your phone or your tablet and take into the treatment room with you to practice. Where you get unlimited access to all existing and all new content that is added. So access to all the existing content plus all the new content that I add. And you'll get ongoing access to continuing education credits without leaving your treatment room. That sounds good, especially right now. There's currently over 60 continuing education credits available if you are an MTAA affiliated therapist. And there's credits approved with the NHPC and also with Komoda. So these are just the Alberta massage therapy associations, but most massage therapy associations will give you, as a therapist, credits for online training. If you just look into your, your association's guidelines, it'll be under something probably called self-directed study, where you can get credits with online training. So what exactly is in Tissue Talk? Tissue Talk is designed to enhance your skill set and your confidence to effectively treat the 3 most common pain patterns that your clients will complain of. So there are 3 main pillars in Tissue Talk. The first pillar is the upper back and neck, and then there's a shoulder and low back pillar that I'll show you in just a second. So in the advanced technique pillar number 1 for the neck and upper back, you'll see, like I'm showing on this image here, we do a lot of very precise targeted treatment, just like I was talking to you about when we went through the scalenes, and especially focus on doing sideline treatment for the neck. And it just gives you such an easy access to the whole upper back and neck and shoulder and pec region. And it helps to keep your client relaxed. A lot of clients, when you work with neck problems, tend to hold their neck very tight. And when you have them in a supine position or on their back, they don't want to relax and give you their head. So it puts less strain on your body, and it can be very effective to treat neck problems. So in the advanced techniques for the neck and upper back, there's several different modules that are in there right now. And again, you get access to all of these modules unlimited, and all the new modules that I put in. Each one is a video that's around 12 to 20 minutes. They range in length depending on what it is that I am teaching you. So this is just a quick look of some of the things that are in the neck and upper back pillar. Kelly Sweet figures that Tissue Talk has been a godsend to her. She said, I just wanted to say that the Tissue Talk Academy library has been a godsend. It works great to watch video training modules right before I'm going in to treat a client with a specific problem or a complaint. And this is what I've heard actually from a lot of the Tissue Talk members, is that they really enjoy watching a specific training module. If they know they have a client coming in that has, like today's example, thoracic outlet syndrome, they'll go in and watch all the videos associated with effectively treating thoracic outlet before the client comes, to give them a quick review of what it is that they should be doing with them. So it works really good to take these videos right into your treatment room with you. So the second pillar is the shoulder rotator cuff pillar. And we all know that the shoulder is also a very common problem that you see in your clinics. And it's really one of the most challenging joints to treat, because it's such an unstable ball and socket joint that is kind of held together with the tendons and the ligaments. It's not like the hip joint where the femur is in a really deep socket in the acetabulum. With the shoulder, the head of the humerus is just kind of hanging in the glenoid fossa, and it's stabilized with all the muscle and tendon attachments. So it can be quite a challenging joint to treat. But in the modules, we talk a lot about how functional movement of the shoulder requires balance between movement of the scapula and movement of the glenohumeral joint. And we look into assessment of the shoulder and look at all the rotator cuff muscles, and understand that with the shoulder, the most important thing is that we need to get it moving or keep it moving, and that motion heals. So here are some of the examples of the modules that are located in the shoulder module, or the shoulder pillar. And then the third advanced technique pillar is all, of course, lower back and hip problems, because that's the third most important or most common thing that we see in our practices all the time. So again, you're going to learn how to isolate and treat all of the lumbar spine and pelvic muscles. And one of the things that I really focus on is treatment for the iliopsoas complex, or the hip flexors. And you can see that pictured on this image here. The psoas is pictured in red there, running from T12 down towards the iliac crest. And most people that have lower back pain have tight hip flexors, and they also commonly have weak extensors. So we talk about how to create more balance by lengthening the hip flexors and strengthening the hip extensors. And we learn a lot about different assessments and corrections to correct common pelvic imbalances, like high ilium correction and things like pubic symphysis dysfunctions and that kind of thing, SI joints dysfunctions. So again, here's some of the different videos, modules that are in the lower back. And all you do is you go into your, log into your Tissue Talk Academy site, and you just click on the the video. And if you want to watch the high ilium video, you just click on that and it loads and off you go. Easy and as simple as that. So Lara Tremblay has been really enjoying Tissue Talk, and she says that my clients have noticed amazing results. My clients love the results of the techniques that you taught me. I found the neck and shoulder pillars especially to be remarkable, fun, and informative. Cheryl is an awesome instructor, friendly, knowledgeable, and to the point with her instruction. I would recommend Tissue Talk to any therapist looking to expand their education and improve on their own techniques. Thanks, Laura. I'm glad that you are enjoying all of that. Well, the next pillar in Tissue Talk is all about rehabilitative exercise modules that go along with all of the technique pillars. So you'll get video descriptions and videos about rehab exercise modules that'll help you improve your range of motion and strength deficiencies for all the different conditions, lower back, shoulder, and neck. And I really feel it's of utmost importance for us as massage therapists. I guess this is a little bit because of my physical education background, to be teaching them how to do the proper strengthening and stretching exercises so that they can take an active role in their rehab and get a lot more complete and longer lasting results. And this image is of one of my therapists doing a correct hip flexor stretch. So many people do a lunge hip flexor stretch and do not do a pelvic tilt first. And then when they lunge forward into a stretch, they end up getting a really severe lumbar lordosis and putting a lot of strain on anterior tilt that you probably have before you even start doing this. So again, these videos show you exactly how to do stretches so that you can do them for yourself, which is extremely important, and also be able to feel confident to teach them to your clients when they come in for treatment. And there's no reason why teaching your clients proper exercises cannot be part of your treatment session. I find it's actually sometimes the best to teach people one or two exercises at the start of the session instead of at the end when you're kind of running out of time. And I also find it's really important to make sure that when your client comes back the next time for a treatment, that you get them to show you how to do the stretch that you taught them, because it's my guess that they probably have gone home and done it somewhat incorrectly, and they might be doing it poorly and actually causing their problem to get worse. So it's really important for you to get them to show you how to do it rather than you keep showing them. Okay, so this fourth pillar is all about rehabilitative exercise. So here again is some of the different rehab exercises that are currently in the Tissue Talk Academy. And then what's Michelle got to say about Tissue Talk? She figures it's great, and she says that each of the 3 advanced technique pillars is packed full of everything from new techniques, exercises, anatomy review, and assessments. These are by far the best massage therapy programs I have ever taken. That is so awesome to hear from people, and so great to see how much success they're having with the techniques that I teach. So thanks very much, Michelle, for that awesome testimonial. Michelle Keeley is another one of my successful Tissue Talk graduates, and she states that the entire Tissue Talk Academy is great. Each of the 3 advanced technique pillars is packed full of everything from new techniques, exercises, anatomy review, and assessment. These are by far the best massage therapy programs I've ever taken. So thanks very much, Michelle, for saying that. And this is what I want for you as well. Kelly is another Tissue Talk graduate, and she's found it really helpful watching the Tissue Talk modules right before going into a treatment with a client that has a specific problem. So say, you know, a client is going to come in and they're having thoracic outlet symptoms. You can go in and look at all the videos associated with thoracic outlet, like the scalenes, the pecs, the levator, and all those, and watch them right before your client comes in and help remind you what you want to do with them. So Kelly's found it really, really helpful doing that. And then there's even more in the academy. So I also really have understood over the years of teaching massage therapists that a lot of therapists are really weak when it comes to business mindset and business strategies. So I've included a whole another pillar on business strategies, and really we need to realize that we are a business, and we need to realize that everything our client sees and hears and experiences impacts our business. So there's a whole section on business strategies for the massage therapist too. Things like helping you decrease no-shows and create more client satisfaction. I forgot about this one. There's actually another pillar. So pillar number 6. So not only do we need all of the techniques and the business strategies, but we also really need to be working on that 6 inches between our ears in order to be successful in business. So there's a whole nother pillar on mindset strategies, success mindset strategies for the therapist. And it teaches you all sorts of awareness skills. And one of my favorite things to use when I need to stop and check in with myself and make sure I'm going in the right direction is this whole idea of stop, look, and choose. And it's all about having present-minded awareness. So if you're not sure what's going on, like let's say you're getting a bunch of no-shows in your business, and you're getting frustrated with people and you want to lash out, and you're not sure what you're doing wrong or right, and people are no-showing you. The whole idea is to stay in the present moment and stop and think about what it is that you're thinking, okay? And think, okay, can I get ticked off about everybody and lash out at my clients? That's probably not a good idea. Can I get really mad at myself that I'm doing something wrong? Or can I stop and look at the other side and think, okay, here's maybe some of the positive things that I could do in order to make a positive change, and choose that direction. So it's all the idea of being in present moment. And every time you're faced with a decision, before you just automatically react, you can stop, look at your choices, right or left, and then choose which is the best direction for you. So pillar number 6 is all about that 6 inches between your ears, your mindset. Okay, so let's take a look at everything included in the Tissue Talk Academy all together. So 6 pillars. The first three pillars are all of the advanced techniques for the neck and upper back, the shoulder complex, and the lower back and hip. Pillar number 4 is all of the rehab exercise modules. Pillar number 5, that's supposed to be, is the business strategies for the massage therapist. And pillar number 6, those success mindset strategies. So you're probably wondering what all of this is worth. All of these 6 pillars of the Tissue Talk Academy. Well, the first thing that I'd like to say is that many of my Academy students have doubled and even tripled their income and their clientele after developing their Tissue Talk skills. So I can't tell you exactly what Tissue Talk is going to do for you because I don't know you yet, but I do know that it's done this for many of my students. Shauna, who I introduced you to a little bit earlier in the master class, states that her clientele has tripled. And ever since she took the first course with me, her clientele has tripled, and it keeps building. I can't thank you enough for what you've done for me and my clients. So Shauna, when she first decided to do some training with me, she was struggling with having that steady list of clients and really building her practice, but now she has tripled her clientele and it keeps on building. So Can you imagine what it would be like if this was your results and this is what I want for you? This really can be for you too. And Teresa states that she insists my therapists are Tissue Talk certified. I have used the techniques that you teach and they work wonders. If I were to hire any other therapist at my clinic, I would insist that they have certificates from Tissue Talk. That would ensure me that they are serious about their work and that they have been taught valuable therapeutic techniques. So thanks, Teresa, for that testimonial. Okay, so what is all of this worth? Well, let me explain the breakdown for you. So the first three pillars, all the advanced techniques, have a value of $997. The exercise modules have a value of $997. The business strategies and the success mindset strategies also have a value of $497. So the total of all of that is a value of almost $5,000. However, I'm not going to charge you $5,000. I've bundled them all together so I can offer you all the pillars for only $1997. How does that sound? Okay, and that sounds a lot better than almost $5,000. And then what else can I do for you to make the value even greater? Well, you will also get PDF copies of the advanced technique manuals for the neck and upper back, the shoulder, and the low back and hip. And these manuals will give you instructions that will guide you through all of the different techniques, just like the videos do. And they also give you anatomical overviews and trigger point referral patterns. So when we add in that bonus of the technique manuals, the total now is over $5,000 and it's only $1997. I know that this is totally a value of $1997, but I also know that I've been where you are, and it's sometimes hard to commit to investing in yourself, to investing in your personal development, because you have lots of other expenses too. So I'm not even going to charge you this $1997. But if all this did was give you proven effective therapeutic techniques that you could implement right now into your treatment protocol, do you think that a one-time payment of $1997 would be worth it? Or if all this did was boost your confidence so you feel like an expert, do you think a one-time payment of $1997 would be worth it? Or if all this did was reduce the strain on your body and increase the longevity of your career, do you think a one-time payment of $1997 would be worth it? So remember, this isn't just about you. This is about the ripple effect that you will create, the impact you will have on your clients' lives, the positive change that this will create for your life and your family, and also the difference it's going to make to your bank account. Teresa Lenarduzzi states that you're really missing out if you don't enroll, that this training is a must-have. If you are a serious massage therapist, contact Cheryl for information about her online training called the Tissue Talk Academy. So let's just take a moment, and I want you to picture yourself right now. Take a deep breath. Picture yourself right now as the expert gifted therapist that everybody is lining up to see. What would it feel like if you were able to work with your ideal clients? What would it feel like to be able to work with your ideal clients? What would it be like if you could raise your prices and actually do less treatments and make more money? What would that feel like? So, as I said, I have no doubt that this training is worth $19.97, but because you're here on the webinar today, I want to show you what I'm going to do for you. So here's everything that's included in the Tissue Talk Academy, with the bonus of the PDFs of the advanced technique manuals, well over $5,000 in value, priced at $19.97 because I've bundled them all together. But because you're here on this webinar today, and I want to make it as easy as possible for you to take action now, to do this right now, I want to offer you this entire Tissue Talk Academy bundle package for only $9.97. Okay, so that's well over a $5,000 value for only $9.97. That's what I want to do for you today because you're here on this webinar with me. Now, you're still here on this webinar, so you must realize that you want something to change in your life and in your practice. So it's probably a good time to take action. Or maybe you're just needing some inspiration because you've been practicing for a while and you're feeling a little bit stagnant and you just need some new inspiration. Or maybe you feel like you just need a little bit more confidence to step outside of your comfort zone and really create the kind of practice that you want, the practice of your dreams. So wherever you are in your massage therapy career right now, I'm really confident that the Tissue Talk Academy can help you take your practice and your life to that next level. So when you enroll in the Tissue Talk Academy, you're going to get immediate access to all the present content that's in the Academy. And there's like over 60 modules in there right now. And you're going to also get access to all new content that I continually put in there. This is unlimited access. There's no expiry date, and you can use the training over and over and over again. And I also have something very exciting coming real soon, like within the next couple of weeks. I have decided to create my own Tissue Talk Academy app on your mobile phone, an app for your mobile phone, and very soon you are going to be able to access all your Tissue Talk Academy right from your mobile phone on that app, which is going to be very cool. I'm very excited about that. It's really important that you take action now and take your career to that next level. And I know how hard it can be to make it on your own. So there's one more friggin' amazing bonus that I want to offer you today. I want to offer you something that most online programs do not offer, and that's my personal support and guidance through the program. So if you decide to take action and invest in the Tissue Talk Academy today, this is a 24-hour limited bonus. You are also going to get 4 virtual group coaching sessions with me. And I want to make sure that you get massive value from all this training. And I want to be able to do live reviews of some of the Tissue Talk modules with you. I want you to have access to me. And I've been where you are. I understand where you are. I understand your problems, and I can help you find solutions to those problems. And I want you to have the opportunity to ask me questions live and to connect with me personally, and also to connect with other like-minded Tissue Talk Academy members and other elite business owners. So what this involves is during the first 4 months of your Tissue Talk membership, you get to come to one of these virtual coaching sessions, and they are right now scheduled for the 4th Wednesday of every month at 10 a.m. Mountain Standard Time. So this is a huge bonus that I am really excited to be able to give you, because I really want to connect with you personally and make sure that you get the most success that you can out of your investment in the Tissue Talk Academy. And I really want to help you succeed. I want to be able to give you one of these certificates put your name right there where it says Magic Hands so that you can submit this to your Massage Therapy Association and get credits. So when we add this virtual coaching bonus in, remember this is for the next 24 hours, and we put that into the total bundle, the whole bundle now that I'm offering you is almost a $6,000 value. And remember, you're getting it today on this webinar, including this bonus if you act within the next 24 hours for only $9.97. How does that sound? So I'm going to stay on the call here after the webinar is over, and Cindy's going to be putting right now in the chat box the order form link for Tissue Talk Academy. So Cindy, you can put that in the chat box if you haven't already, and you can actually choose a pay in full option, or there is a 3-month payment plan. So I want to leave you with this final quote, and then I'll answer. Please stay on the line if you have any questions. Don't go anywhere. And I also have a little gift for you at the end. But Susan Lavery states that I'm really enjoying your videos and can't wait to practice the techniques. I love your teaching style and the great camera angles. And I hope to meet you one day, but in the meantime, this will be perfect. You are such a great educator, and I'm so happy that I found you. So let's just think about it. If you're still trying to figure this out in your brain, and can I do this? Well, how many treatments would you have to do to cover your cost of Tissue Talk? This is just a one case scenario. Let's say you do about 20 treatments a week and you make around $50 per treatment. You could literally earn enough income to pay for Tissue Talk in 1 week, and you would have the training to use over and over again as many times as you want with no expiry date. So you really need to believe in your future and believe that investing in yourself is the thing that's the most important. Bottom line is, as we wrap up here today, I guess, is that you have two choices. One choice is to do nothing, but you made it to the end of this webinar now. So if you do nothing, probably things in your career and life are going to stay the same as they are right now. And remember what Einstein says, the definition of insanity is doing the same thing over and over and expecting different results. So just take a moment right now and picture how you would feel if you don't invest in yourself today. Are you going to feel disappointed, or are you going to be okay with that choice? How are you going to feel if you don't invest today? So, of course, your second choice is to enroll in the Tissue Talk Academy. I hope you can make the choice right now to get the missing pieces of the puzzle so you can create massive success and start moving forward towards the change that you want to create. She says, you are a really good teacher, and I use your techniques all the time with great results. I have taken other courses that were mostly marketing scams, all hype and very little substance. The Tissue Talk Academy is amazing value, and you are the teacher I wish I would have had in massage school. So I'm so glad that I can be of service to dedicated therapists like Shirley. And I hope you got tons of value from today's presentation and you're ready to become a Tissue Talk expert. My name is Cheryl Stevenson, and I'd like to thank you for spending your time with me today. All you need to do is go to tissuetalk1.com/start now, and it will give you the registration form and all of the details. Yeah, so this is the registration form. That's that link that I just put in the chat box.
Right.
And so you can make a one-time payment of $9.97 and plus the GST, of course, because we all have to pay that.
Unfortunately, yes.
Unfortunately. Or I also have it set up where you can make 3 monthly payments. So that works out to $383 per month. Or you can also go on a 12-month payment plan, which is $97 a month. with the GST is 101.85.
Right. Okay.
So of course the best deal, if you can swing it, is to pay for it all at once.
Right.
But there are that 3-month or 12-month option available for you. Okay, can you see my website now, you guys? Just give me a wave. Okay, Anna was wanting to look at the low back. So this is what the website looks like. See how when I hover over all of these categories, here's the low back pillars, here's the neck and upper back, here's the shoulder. Over here is the biz tips and the self-help. And then under each one, there's techniques and also the rehab exercises. So right now in the low back one, there's 13 different techniques. So is there a particular technique that you want to see? How about if I just pick one? That's way too many questions for you.
Sure. So let's QL. Let's do QL.
QL, okay.
Thank you.
No problem. So you just click on that one, and then you'll see here that it has all sorts of notes underneath that takes you through some of the anatomy and oftentimes the trigger point referral patterns. So it's got all of that there for you. And all you do is click the button and hope your internet is working. And it loaded really quick here, so that's awesome. Hello, and welcome to this month's edition of Tissue Talk. So you'll see many different hairdos, and I'll look a little bit different because it's been 10 years that I've been doing this. So you'll see me at lots of different stages of my life. So I'm going to play this, and I'm also going to put it on full screen so you can see it a little bit bigger. So right now you have the ability to watch this on your desktop or your laptop. And when I get this app completed, which hopefully will be in the next couple of weeks, it's just being launched. There's going to be a Tissue Talk app right on your phone that you can have access to this through your app, which is going to be friggin' amazing. So almost all of the QL is underneath this paraspinal muscle mass, which will be wider on some individuals than on others, depending on their surface anatomy. That we investigate the tissues along the iliac crest, right through the middle of the muscle belly, and also right up underneath the 12th rib where they attach. The type of motion is a downwards and inward motion, down to the table and in towards the spine. If we just go on top, we are going to be more through the paraspinal. So we have to get in underneath that paraspinal muscle mass and go down and in towards the table. So I can tell just by investigating Val's tissues here that she's got quite a thickness through her QL right in the middle here. So I'm just going to slide slowly into the tissues. I'll get this hand out of the way for you. And I can feel that thickened tissue there. Now I can put my other thumb on top, and I can do some trigger pointing just by applying pressure and doing a little bit of a rocking motion until I feel those tissues start to loosen a little bit. And I can be asking the patient if they're having pain referral, how much it's hurting on a scale of 1 to 10. So again, it's just really important. Okay, so again, I talk a lot about how to access the tissues and that the pressure has to be down and in towards the spine in order to get to the QLs. It exposes the QLs a little bit better than in the prone position for some patients. So the most important thing is to get them in a proper position. The bottom leg is bent so that they just feel supported and comfortable. The top leg is straight and slightly extended if you want to, but just in a position that they are comfortable. The top arm is going to be elevated above the body so that you can really open up this area from the top of the iliac crest to the 12th rib. And you can place a rolled up pillow underneath their back, basically to really try to open up the rib cage. If the arm is down here, it doesn't open up this area as much as if we raise the arm up overhead. That raises the rib cage and really gives us access through where the QL muscles dive underneath the paraspinal muscles. Now, just to landmark the tissues again, we're going to come along the top of the iliac crest. And again, here's the whole paraspinal muscle mass, and we want to get in underneath that paraspinal muscle mass down towards the spine. The middle part of the QL is the easiest to access here, and the upper part of the QL. So I've got my thumb right on Val's 12th rib. So basically just a small area here where we can access the QL fibers. So what we're going to do is, again, landmark from the ilium, crest of the ilium to the 12th rib, slide underneath the paraspinal muscle mass and pressure down towards the table, diving just underneath the paraspinals. So I'm just sliding and sinking. And I'm going to apply pressure with the other hand now so that I can use the top thumb as a brace. And then we can do a very effective active release technique. So again, I can start medially and roll over the paraspinal muscle mass, or I can start laterally and roll underneath the paraspinal muscle mass to find that adhesion in the QLs. And we'll see if I can find the worst one to pick on here. One thumb over the other to brace. And then Val, a little bit of a hip hike, and then relax. Just relax for a second. As soon as I get Val to do that hip hike, I can feel the tissues pop right up underneath my thumb. So that you can be confident that you're landmarked properly. So pin the tissues, Val, a little hip hike. Good. And then stretch your leg out and reach with your upper arm too. Reach, 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 reach. And relax. And then okay, so pin and stretch can be so effective with so many different tissues, and basically you get them, like, because the QLs are hip hikers. If when they hike their hip, then that activates the tissue and you can make sure that you're landmarked properly. And then when they stretch their leg and their arm away, that puts the tissues on stretch. So how's that for you?
That's amazing. Thank you for sharing. Thank you.